An urgent review is looking into whether the link between obesity and the coronavirus is stronger than previously thought.
Obese people with COVID-19 are not only more likely to end up in hospital, but are also more likely to die from the virus.
Well, here to discuss this further is Dr. Philippa and diet guru Steve Miller. Welcome to both of you. Thank you for joining us this morning. So, Dr. Philippa, can we start with you first of all, please? What is this urgent review? Just explain that a bit for us.
So, as we've mentioned many times before, the virus didn't exist, 6 months ago. And as we find out more and more about it, we're noticing certain associations. Now, association doesn't mean causation. So we are noticing that people with obesity seem to have more difficulties when they have the virus. It is not clear. Is it the obesity itself? Is it conditions that are often associated with obesity, like type 2 diabetes? Or high blood pressure that is causing this issue. So we need to look at the evidence which is still emerging in order for us to try and see what is going on and therefore not only decide who is most at risk, but how best to potentially treat.
Well, yesterday, the Health Secretary called for an urgent review on the link between obesity and coronavirus. Matt Hancock said emerging data from around the world suggests that there could possibly be a relationship between obesity and the impact of COVID-19 on individuals. Too early to say. Scientists around the world believe obese patients are more at risk of serious complications because their immune systems are worn out after repairing cells damaged by excess fat. And research at the University of Texas suggests fat cells of patients with obesity or type 2 diabetes increase production of proteins, which the new coronavirus latches onto in the body, especially in the lungs. So, Philippa, that science is looking into this.
Absolutely. So we already know that obesity is a pro-inflammatory state. So that means that there is more inflammation in the body. It already involves the immune system. And therefore, it's not unreasonable to go and look and see whether or not that affects your risk of infections. We know that it affects your risk of lots of things, from heart attacks to strokes to certain kinds of cancer. What we do know, though, is that even if you do have obesity, if you, for example, move more, increase your muscle mass, so you're not necessarily losing weight, but that you increase your muscle mass, muscle produces anti-inflammatory chemicals. So doing that could help shift that balance within the immune system and help your reaction to COVID-19. And that's why we need to be doing much more research into this.
And isn't it, Philippa, a reflection on our lifestyle, where we've got to, how big we all are now?
So we know that there is an obesity epidemic in this country. About 3 in 10 adults have obesity. But it's not as simple as just the environment or just what somebody eats. We know that 80 to 85% of obesity is down to your genes. There are over 600 genes which are involved in the development of obesity.
Philippa, can I just ask you a question there, though, on that, just to clarify that, because I've heard that argument a lot, and it is fascinating. So if it is genetic, how come there weren't fat people 100 years ago, or as many as there are now?
There's a combination of things, and it involves something called epigenetics. Now, epigenetics is when the environment affects which of your genes are come to light. So you can have a gene, but it might not act, it might not show itself. And what we know is things like ultra-processed foods and when you gain your weight decide how many of those genes are expressed. So, for example, if you are a child, lots of those obesity-related genes are not expressed yet. But if you become overweight as a child, more and more and more of those genes become expressed. So if you either prevent childhood obesity or you treat childhood obesity before you hit being a teenager, less and less of those genes will be expressed, which means that you will have less difficulties later on in life. So it's the combination of the environment and our genes. When we look around the world, we look at a country like Samoa, which has some of the highest rates of obesity, and those only started when the Western diet came in. And what we're thinking is that it's that ultra-processed food that essentially pulled the trigger on that genetic gun. So it's the combination of the two things.
OK, let's bring Steve in now. Thank you for joining us, Steve. So
I'm very, very impressed listening to that. Can I sound really direct? Because all we do in the UK, for some reason, is like to complicate the issue. The scientists quite often disagree with each other. I think Phil's point was absolutely right. We have to remember that no one is fat in a famine. You know, it just doesn't happen. And also, the message we really need to be putting out there, rather than the kind of academia, is the positive message that people can take action to lose weight, to manage their health, so that if, unfortunately, they do get COVID-19 and go into hospital, then they will have managed their weight, so they're less likely to die. I don't think we should be putting out the message of how complicated it is and blaming our genes. You know, we seem to blame everybody, except the one person we don't seem to look at is ourselves. And I think we need to do that. Yes, support people. It's not about being horrible to people and being nasty to people, but it is about saying, actually, there is something you can do. And there is, you know, all the things we know we should do. And push that message. Because the bit that I kind of do agree on is that weight loss is a state of mind. It is not really all about the food. I mean, we've had so much health education in terms of what we should eat, what we shouldn't eat. The reason, unfortunately, this country is getting fatter is because we suffer with can't be bothered itis in terms of using our head to determine what we do. And you know, and I really ask all GPs, all doctors out there, to be putting out a positive message and, you know, and to be saying to people, it is your responsibility. Yes, we will support you. But I'm afraid at the moment, and I will give you a blunt reply to it, you know, the blunt message, I should say, is that if you are fat, you are on death row. Sorry, guys, that is the truth. And we've got to stop being frightened of putting that message out there.
Steve, bearing in mind now, there will be, as you quite rightly say yourself, you know, it's not about being nasty. It's not, it shouldn't be about singling people out. The research is all still very new on this. The causation of this is still not fully understood. However, there will be people who are obese, overweight, fat, watching this now thinking, oh, my God. Now, the thing is that there are things you can do quickly, but you can't lose weight quickly. And so if they're now looking like they could be in a vulnerable group, then should they be amongst the first in line when the vaccine comes out?
Do you know, Phil, I don't want anyone to lose their life. I don't want anyone to lose their life. And, you know, if someone is obese and they are vulnerable and they're potentially going to lose their life because they have, you know, whatever, then, of course, give them the vaccination, of course. But we need to also, at the same time, put out the message that, do you know what? You've got to start taking responsibility for your body. I help people lose weight, manage weight every single day. And I can tell you now, it is not the food. It is not the food intake. It's a complete state of mind. And what we have to say to people is actually down the road, if you're not doing something about your weight, you're going to pay a premium for your health care. Now, I think that's fair, unless there are, of course, mitigating circumstances. It's a balanced opinion.
So Philippa, in which case then, like Phil said, this isn't something, it's not like you can go and wash your hands and instantly you can do this. This is something you're going to have to work on and lose weight safely over a period of time. Whilst doing that, would you suggest that if you are obese, that you should stay inside, like what is being suggested if you are of a certain age?
So first of all, if I could just rebut something, which is to say that Steve was talking about how it's just in your mind, it's a state of mind and you can decide. The evidence is really clear. Only 1 in 20, so 5% of people with obesity, a BMI over 35, will be able to lose the weight by diet and exercise alone. And whilst we absolutely should be delivering messages about healthy lifestyle and eating and exercise, it is important to be realistic so that we don't assign blame to people.
Sure. OK, you've made that point, Philippa. Holly's question was, should obese people now be staying home as has been recommended for the over 70s?
So I think that everybody should be practicing their social distancing and staying at home as much as they can. There isn't evidence to say that people who have obesity should be shielding in the same group of people who who've had an organ donation or something like that. So there isn't the evidence that says that at the moment.
The figures, Philippa, are scary. And anyone who is overweight and reads this, researchers at the University of Liverpool warned last week that obesity increased the risk of dying from coronavirus by 37%. Almost three-quarters, 73% of COVID-19 patients who go into critical care are overweight or obese.
Yes, but they also may have type 2 diabetes and high blood pressure. And right now, the evidence is saying that they do not need to be shielding at home. And if you are going to be staying at home, you're actually less likely to eat well and exercise. If I had obesity or my patients have obesity, what I would be saying is move more. The more muscle mass that you gain, the less inflammatory you will be within your body. So I would be saying move more.
Steve?
Unless it's your genes. I thought you'd be saying it's my genes. You know, I'm in your surgery or wherever, and there's nothing I can do because it's my genes. You've been telling us it's our genes.
And what I said was that it's 80 to 85% controlled by your genes, but there is an environmental trigger as well. And that even if you do have obesity, being fit and exercising will make a difference to your risk factors.
Can we agree? Can we agree to put out the message today to everybody, all our population, that if you are too fat, if you're obese, whatever, there is something you can do about it, rather than just telling everyone to blame their genes?
I'm not saying that they should just blame their genes. I'm saying it is not as simple as this is your fault. I'm saying that it is much more complicated than that. No matter what situation we are in, absolutely there are things that can be done. You can speak to your GP. There are lots of medical treatments. There are surgical treatments. And bariatric surgery has evidence that it really makes a difference to obesity.
You're telling me you want to throw people on an operating table? Is that what you're saying? Bariatric surgery?
I'm talking about where the evidence is, actually, because most people who do manage to lose weight will then put that weight back on plus more, and that's due to something called the defended fat mass, which is a very complex
challenge. Let me give you a challenge. I challenge you to get me 3 people in your view whose genes will prevent them from losing weight, and I spend a few months with them, maybe even living with them, and let's see if they can't lose weight.
And I will rebut that by saying this. A study with N equals 3, so a study population of 3 people with a huge amount of input into their diet and their exercise and their psyche is likely to work, but that is not the same as a public health message for millions and millions of people.
We're going to have to leave it there. Thank you.
Thank you very
it really is.
much.
It really is. Thank you both very much.